All right, well, in the interest of time, I know we still have more joining, but I think we can get going because we definitely have a critical mass. My name is Alison Hamilton, and I want to welcome you all to our session today about documenting the complexities of implementation with periodic reflections. This session is being hosted by the UCLA 3R Implementation Science Hub, which is funded by NIH and associated with CHIPS at UCLA, led by Steve Shoptaw. I want to thank Elena Rosenberg-Carlson for making all the magic happen and making all of our lives much easier on a daily basis. And it is my great honor and privilege to introduce you to Erin Finley, who is a consultant for our hub and is a very close, dear colleague, fellow anthropologist, and the world periodic reflections expert. So we're so excited to do this session with you and share what we've been thinking about and working on with this approach. I think I can hand it over to you, Erin, from there. Anything else I need to mention?
No, I think this is great. I really appreciate everybody being here. I'm really excited. This method has been something that's just been really useful to kind of have in our toolkit. So it's fun to get to talk about it and share more about it today. So thanks all for joining. Let's go ahead and talk a little bit about acknowledgments. So we really wanted to stop and say thank you properly to all the different studies that have supported this work. We're going to talk about a number of them today as part of the training, using different examples, because one of the nice things about this method is it can really be tailored for use in different ways across different projects. So that makes it very flexible and handy. And then a lot of wonderful colleagues that we have the opportunity to work with who've played a big role in how all of this has developed. So, and did you want to do the poll?
Yes, sorry, my dog has decided it would be a good time to make his presence known. Before we get started, we just want to get a feel for everyone who's with us today. So we're going to do a couple of quick poll questions. So our first question has to do with your level of experience with qualitative research methods. Are you new to these methods, familiar, but have never used them, some experience using them, or extensive experience using them? Thank you all for your quick participation. We've all become total Zoom pros. So we have a pretty even split, Erin. I don't know if you can see it, but we have an even split between some experience and extensive experience and a few folks who are familiar but haven't used them.
That's great. Okay. I'm going to try and click out of this here. Okay.
All right, and then our second one is, what is your level of experience with periodic reflections? New, familiar, some experience, extensive experience.
Okay. That's really helpful. Thank you, everybody.
Excellent.
Okay.
Thanks, everyone. Right, I'm going to go on mute, and just so you all have a sense of the process, Erin is going to lead our session. I'll pop in now and then, and I'll also keep an eye on the chat. Erin will not be keeping an eye on the chat, so I'll be kind of curating questions for her. If there are important things that I need to interrupt her for, like points of clarification, things like that, I'll do that. And otherwise, we have it set up so that we'll get through a certain amount of content, then do some Q&A, and then continue on with content. So there will be time for questions, but if there's pressing things, I'll interrupt. So I'll keep an eye on the chat with you all. So, okay, thank you so much, everyone. Enjoy.
So if I learned anything during COVID, I learned that I am terrible at multitasking. So it is very helpful for Alison to handle the chat, and then we'll go back and forth if we need to, but really appreciate the chance to kind of go back and forth in the chat. So I will say broken this up into 4 sections today. So we'll talk, starting off a little bit about the rationale and kind of the ethnographic grounding of these methods. And then talk some about design in terms of how it can be useful to think about periodic reflections as part of a larger study design in different kinds of implementation research. And then we'll stop and we'll really get into the nitty gritty about data collection and then what my lessons learned have been in terms of working with these. And then we'll focus towards the end on analysis and some of the different ways that these can be analyzed, because we've used them a number of different ways and found that to be fruitful. And then in the literature, we're starting to see some different examples as well. And it's really interesting and exciting to see that. So, but at the end of each one of these sections, we'll stop and do some Q&A and chat. So we'll have a little break here and there. It won't be all me talking, which my kids would assure you would be very uninteresting. So let's go ahead and dive in from there. So thinking about the rationale. So ethnography has become an increasingly popular tool in health services and implementation research. And it's particularly useful because it can produce findings with very high external validity. It's not necessarily a term that everyone is familiar with. Of course, Alison and I are both anthropologists, so this is kind of where we come from. But it's worth getting all on the same page about what we're talking about when we talk about ethnography or ethnographic approaches. So really coming from the perspective that this is a methodological approach grounded in close engagement with a social group over time. So you can't really do interviews with a group once and call that ethnography. It really is about what do you learn by being engaged with people over time. It almost always involves use of multiple methods that you then ensure some kind of triangulation or integration of the methods. It's really grounded in people's actions and experiences of the world, and then the ways in which their actions arise from and reflect back on those experiences. So we're all moving through the world, we're all learning all the time. And ethnography is really attentive to that process. And then really grounded also in insider or emic viewpoints. So wanting to know what's going on for the folks who are involved in the process. So I think all of this is going to make a lot of sense in terms of implementation already, but maybe we'll make that a little bit more explicit. So when we're talking about ethnographic methods, we're really talking about what are some of these tools for observing behavior in a natural environment. So understanding why people are doing the things that they're doing. And also, and I think this one's one of the uniquely good things about ethnography is it can be helpful in observing the difference between what people say and what they do. Because we all, I think, maybe have a cognitive model for how we do things, but once we get out into the world, that may or may not exactly fit how things happen. So ethnographic observation and methods related to that can be very helpful in capturing those differences, and those differences can be really important, particularly when you're talking about setting up a scenario for behavior change as an implementation. The other great thing about ethnographic methods is they can be really attentive to the local ecology and well-equipped to study multi-level phenomena. So what's going on at the individual level, but also what's going on at the group level and the larger level, whether that be organizational or national policy. They're nimble for these kind of multi-level analyses. So in terms of ethnography and an implementation, a really great scoping review. And I will say throughout, I've put references where I can at the bottom of the slide, and then there are references at the back, because the great thing about doing these kinds of presentations is you always have an opportunity to see new wonderful work that's out there. So this is a great study that came out recently, and I would encourage everyone to read it if you have an interest in this area. But it was a scoping review looking at the use of ethnographic approaches in the last few years. There were 73 articles that met the criteria. And it was interesting because most of them really focused on looking at determinants in implementation, where they were trying to use ethnography to better understand kind of the context-specific phenomena, understanding insider perspectives on what was happening in implementation, and also in studying these complex interactions between what's going on at the individual level, what's going on at the organizational level. And again, ethnography can be a really nice window for that kind of analysis. Apologies to anybody who may have heard this story before, but I always come to the role for ethnography and implementation because I started out as an ethnographer. I didn't start out as an implementation scientist, and I really stumbled into this. I was doing dissertation fieldwork as an anthropology PhD student in a VA in 2007, 2008, trying to understand experiences of PTSD among veterans of Iraq and Afghanistan. And it happened to be the time when VA was really starting their formal rollouts for the evidence-based psychotherapies, prolonged exposure, and cognitive processing therapy. And I have to say, I really came to this and I was so excited because I was sort of a public health person in mindset. And I was like, oh my God, we have this epidemic of PTSD. We have these treatments. This is going to change everything, which was, of course, obviously tremendously naive. But it was so powerful to be in that setting as this rollout was beginning to take place, and in just a very frontline way, seeing the way that different people in this process were struggling with what was happening. So there was this incredible pressure on VA to deliver PTSD care, particularly during this period of time, which was also the surge in Iraq. So there was a lot happening in terms of combat and folks coming back from that. There was a very strong conversation going on about Vietnam and all the ways that the US had failed its veterans of Vietnam. And that was something that was still being shouted about in town halls regularly. It was very powerful. We had a whole generation of VA providers who had been treating veterans since Vietnam with PTSD and had thoughts about how that was supposed to look and how that worked. We had a clinical care model, including scheduling processes and workflows that was all built around a different model of PTSD, which was really that this was a kind of a chronic mental illness. We also had a new generation of providers coming in with different training that was much more focused on cognitive behavioral therapy and was much more amenable to these newer psychotherapies. And on and on and on. There was just a tremendous amount of complexity in terms of how these EBPs were received during that early period. And it made me much more aware of what it means to try and implement something that's really innovative in a setting like this, because the stakes can feel very, very high for the people involved for a lot of different reasons. So what I always like about that example is, I think it helps us to think about, we often have, and in our theories and frameworks, somewhat a modular perspective of implementation, like we'll have something happening at the veteran level if it's within the VA, or at the patient level if it's outside of VA, at the provider level, at the level of the clinic. And we do think somewhat about how these things intersect. But actually, often when we get into the real world, it ends up being much more interactive, much more complex. And one of the things I love about ethnographic methods is they can be really powerful in providing a highly valid view of that complexity. So this is one of the things I really love about ethnographic methods. A lot of times implementation science can kind of lean into more of a measurement-based approach. So things like using scales to assess readiness or organizational climate and things like that. And there's absolutely a place for that. That can be really powerful, and a lot of wonderful work has come out of that. But at the same time, that does sort of presume that you have a sense of what's going to happen before it happens in the study. And you can prospectively plan for how things are going to play out in the study. Ethnographic approaches can offer a lot more flexibility in dealing with the facts that emergent things happen. We can't always predict how it's going to go. So they provide an opportunity to introduce some flexibility into a study design that might, and we're going to talk more about this, but might otherwise be more structured and more prospective in its focus. So we'll talk more about that, but that can be a really handy thing to think about with that. Alison, you've been involved with the Qualris work. Do you want to talk a little bit about that?
Sure. So this work on bringing ethnography into what we do in implementation research is really in a broader context of how we think about qualitative methods in this type of work and adjustments that we've observed that we've needed to make, basically, to methods that we were trained in, such as ethnography. And we had a group of us, mostly anthropologists, I want to say, that was effectively called Qualris. Qualitative Research and Implementation Science worked for a few years to develop a white paper that was ultimately hosted by the National Cancer Institute to go through our observations. Oh, sorry, I see that it might be hard to hear me. Let me get closer to the mic to go through our observations about how the application of these methods differs, and to do a little bit of qual methods 101, but not that much, and then to make a set of recommendations, which is what you see here. So doing more with regard to stakeholder-centered perspectives, to think about how we're using these methods to inform design and implementation, which is a big part of what Erin's talking about today, understanding context, really encouraging more reflection and reflexivity, using these methods to understand implementation effectiveness and mechanisms of change, and of course, to contribute to theoretical development. So this is really where we see a lot of the action with qualitative methods, and ethnographic methods are, of course, a really strong approach for us to incorporate into our designs in order to support these different features of what we're looking to qualitative methods to provide for us. So that's just a broader context. And then Erin and I wrote a companion piece to this paper, which I think is referenced somewhere in here, in psychiatry research, about the use of implementation methods and implementation. So if we need to add that citation, we can, but they kind of go hand in hand. So that's just the broader context.
We can definitely send that around. I did not include that here, so that would be a good idea. And one of the things I also really love about the qualitative methods generally, but also the more ethnographic approaches, I often come back to the dynamic sustainability framework because I think it contains just some tremendous insights about how implementation actually works. And it manages to encompass that in a pretty tight model, and I love that. But one of the things this really pulls out is the fact that any intervention you put out in the world, as soon as you put it out into a clinic, it's probably starting to change somewhat. It's very difficult to make people do the same thing over and over again without shifting and adapting. That's not really natural to how we tend to behave. So interventions tend to shift once you get them in practice. The practice setting is, of course, usually shifting over time. You have people coming and going, you have demands changing, you have new resources, you have fewer resources. There's often a lot shifting in the practice environment we're working in. And then, of course, in the larger ecological system, there's often a lot changing too. And I think COVID, of course, was the ultimate example of how quickly things can change in our ecological environment, and with what profound impacts on everything else. So I always find this a very useful framework to think with in terms of making sure that the methods we're setting up for a given implementation effort are really going to be capable of capturing the different dynamics and variables that are going to be in place during the course of that intervention. So maybe I'll stop here and talk a little bit about kind of the take homes in terms of rationale, and then we can do a little bit of Q&A, take a deep breath, and then talk a little bit about design. But from my perspective, the rationale here is really about the fact that implementation is multi-level, it's complex, it's often unpredictable, and we have to build in methods that can account for that complexity. Ethnographic approaches are wonderful, and we're seeing lots of new ways of integrating those into implementation research in a way that's incredibly exciting. But they also can be really time and resource intensive. So they're not always going to be a good fit depending on the goals of the project. At the same time, we know that understanding implementation and sort of how it goes and its outcomes is going to require understanding change over time. In how the intervention is used, in the intervention itself, in the implementation strategies that are used to put it into place, in the setting, and in the larger ecosystem. So needing to be thoughtful in our methodological designs, that we have introduced enough structure, but also enough flexibility to capture that change over time. So maybe that's a good stopping place. And Alison, do you want to take over a little bit and point us to some of what's happening in the chat?
So far in the chat, it's more like technical. Folks want the slides and they want to know if they can have access to the recording, which we will make available. We're going to make the slides available in chat shortly. Elena's working on that. So far we're just making sure everyone has what they need. But we do have a question. Yes, Omero, happy to see your question, or that you have a question, I should say. That's a good question. How often would one engage in this if things are always changing?
That's a great question.
Very good question.
So we're going to talk later somewhat about timing and how I've used it differently, but the general rule I kind of use is the more frequently things are changing, the probably you need to be doing reflections more often. So in periods where things are more stable, you probably don't need to do them quite as often, but let's definitely come back to that. We're going to talk about that, but I want to hear more because I suspect something interesting has prompted that question. So let's definitely return to that later on.
Yeah.
Are there anything you want to stop and get a chance to say, Alison, while we're at a pause moment?
No, I think we're in a good spot. It's really, just always helpful to think about how we came to this. And I know when over the past couple of weeks, we've been talking a lot about just the innovations that have been arising in qualitative methods in general. And that's really exciting to see. So as you'll see later, Erin will share that there are several teams using this, there are variations. And so I think as with any training that we do, we really emphasize flexibility and we emphasize sort of a more organic approach to how this fits, how you can help it fit what you're doing. So I think that's just an important thing to keep in mind as we go along. But yeah, this is the context that we're in, which is a very exciting and very dynamic context. So yeah, I think we're in good shape.
Okay. Well, from my perspective, that was the perfect cue up for talking about design. So we'll go ahead and dive in, and if folks have things they want us to stop for, we can do that. But so thinking about design, I guess I should say from the starting point that I wouldn't ever use reflections on their own in an implementation effort. They're really intended to work with other methods. So it's really about thinking when you come to study design, what are the needs for the different research questions and or implementation goals of this study, and how do we make sure that the methods are in place that will allow us to truly answer those questions. So we're going to start off with an example based in the Empower query, which ran from 2015 to 2020 that Alison led. And there's a Empower 2.0 is now in place, and we're using reflections again, but in a slightly different way. And I want to talk about how we situated it within the Empower query, because I think it's useful as an example in terms of how do we put these together with other kinds of methods and how does that work. So let's start there. So again, the Empower query, which is enhancing mental and physical health for women veterans through engagement and retention. And that's for those who aren't familiar with query is VA's quality enhancement and research initiative. So this was really like a program project that followed a modified stepped wedge design to implement 3 patient-centered interventions in VA women's health. And this was done across the 3 interventions using an enhanced replicating effective programs implementation strategy. So that was the task of the Empower query. And in evaluating that, we were really looking at patient and provider perspectives on acceptability, on feasibility, and on satisfaction with the innovations. And we were also assessing their effectiveness in terms of, were these interventions helpful in increasing women's engagement and retention in relevant care services and improving the related health outcomes. So you can see there were some multiple moving pieces there in terms of what needed to be captured. A little bit about the interventions themselves. So there was the Tailoring VA's Diabetes Prevention Program to Women Veterans' Needs. This was a gender-tailored VA DPP program, and that project was led by Dr. Tanaz Moin and Sally Haskell. There was also a Facilitating Cardiovascular Risk Screening and Risk Reduction in Women Veterans program, which we called the CD Toolkit. And that was a gender-tailored toolkit for screening for cardiovascular risk and supporting patient-provider conversations about mitigating that risk, led by Dr. Bevan B. Mayberry and Dr. Melissa Farmer. And then we also had the implementation of tailored collaborative care for women veterans that was led by Alison and Dr. Ariel Lang. And the first study was a 1-year quality improvement study, but the other two were both 4-year, 4-site implementation research studies. So these were really multi-site implementation initiatives. So I'll also say that, so we had these 3 interventions that were being introduced into multiple sites, and we were using an enhanced replicating effective programs implementation bundle. So I always think of REP as really a bundle of implementation strategies that are phased across different stages of a project. So you'll have a lot of focus on in the early days on tailoring and adaptation, and then introducing into your setting, working with folks in the setting to make sure this is a good fit and that they have what they need to do this work, implementing and then doing some monitoring during implementation to sort of see how things are going, and then really planning for sustainability. But REP here had also been augmented with more focus on stakeholder engagement. So really building that stakeholder engagement into the implementation strategy, and also building in complexity science. So building in a greater understanding of the ways that change was occurring in nonlinear ways across the course of the implementation strategy. So this was another thing that we wanted to be attentive to as we were designing the methods for Empower, was not only that we were working in multiple sites with multiple interventions using a shared implementation strategy, but using an implementation strategy that was phased, that had a lot of different activities within it, and being able to be attentive to what was happening so that we could understand the outcomes we ended up with. So we were thinking a lot about what are the different pieces we need to pull together in order to capture the data on what's happening at sites, what are the activities, where are the implementation strategies, where are adaptations occurring, et cetera. So we spent a lot of time thinking through the options. Activity logs and adaptation logs can be incredibly powerful strategies for capturing this kind of documentation. The downside is they tend to be pretty high burden and pretty resource intensive. And again, I think they work better when you have a pretty good idea ahead of time of exactly what's going to be happening so that you can kind of build them for that. We knew we were going to probably need some flexibility just because, again, we were using a shared strategy across some different programs that we're probably going to have to implement slightly different ways. There's always meeting minutes. You can use those or ethnographic field notes as a resource for these kind of data. We knew that meeting minutes were going to be a little bit of a needle in a haystack because we had so many meetings and so much happening. And meetings themselves aren't necessarily always going to have time built in for reflection on other things that may be impacting implementation, like larger policy level changes that are going to happen. A lot of times meeting conversations can be quite task oriented. So meeting minutes weren't really necessarily a good fit for the kind of information we thought we were going to need. Ethnographic field notes can be wonderful if your team has a consistent strategy for how they're going to take those and use those. But we also knew we weren't going to be in the sites, so we weren't going to be in a position to do a lot of observations. So that, again, wasn't necessarily a good fit. For folks who aren't familiar with the tool for evaluating research implementation challenges, or the TEC, this paper listed here is a beautiful paper on thinking about capturing sense-making among implementation research teams. And they had put together a tool that was basically a guided discussion for dealing with research challenges and implementation. And when we first started, we were using that. But it turned out that it wasn't a good fit because it was quite narrowly focused on research challenges. And also it was intended to happen when a challenge arose rather than being something, we thought we needed something with greater periodicity so that we would have a more predictable string of data at different time points. So we ended up taking that idea of guided discussions, but then having to evolve it to meet the purposes for this study. Alison, do you want to say more about that before we move on?
I think just one other piece that struck us about that, I mean, one of the great things, as you mentioned, about that tool was that it was one of the only things we could find that gave some operationalization to complexity theory. I think if another piece, if I recall correctly, was that it had a little bit more of a regulatory slant, a little bit more like if there are challenges that have IRB implications and sort of a decision-making tree about that. So it had some elements and concepts that I think were really useful for us in thinking about how are we going to operationalize complexity theory? And then there were some pieces that were a little bit different than what we were looking for. Is that how you recall it as well?
Yeah, no, it was quite focused on that sort of regulatory, okay, is this something where we need to do this or to do this? But if that's something that you're working with in your research, it's a wonderful tool. It wasn't really what we needed for this particular. So what we ended up with then is this model for periodic reflections that has worked very well for us. And I'm just going to give a really quick overview here, but I promise we're going to come back and get into the how-tos more detailed way. But we ended up with basically this model of brief, trying to lean towards shorter, but sometimes longer, depending on how much is going on. So sort of 15 to 16-minute phone calls, approximately monthly, just recurring calls on the schedule, lightly guided discussions, and we'll walk through the questions that we normally use, although those of course can be tailored, done by telephone in the early days. Now we do it often by Zoom, but it certainly can be as low tech as telephone. And we'll do them with individuals, we'll do them sometimes with dyads, and we'll do them with small teams. I don't recommend large teams, but we'll talk more about the participants when we get there. We're really focusing in those conversations just on kind of what have been the main activities, what have been the recent adaptations, either to the intervention itself or to the implementation plan, what have been the kinds of stakeholder engagement that have been happening, and then what's been going on in the environment that may or may not have implications for this particular effort. So again, we're going to go into the details on this, but I wanted to give a quick snapshot of what these are. So now we can think a little bit about how this fits into a larger study design for a complex implementation effort. So I like laying out methods this way because I think it really points to the question of timing in a way that we don't always do. Which is particularly striking to me because implementation is sort of inherently longitudinal. And we don't always really run with that in the way I think we might. But this was, you can see, this was a study we had a lot of moving parts. We were doing interviews with providers during precondition, these are the rep phases, so preconditions, pre-implementation, and then maintenance, so after implementation had formally closed. We were doing surveys with providers. We were also doing interviews with patients and surveys with patients. And then with the teams, we were doing these monthly reflections, approximately. We didn't pull it off every month, but it worked out pretty much monthly. And then we were pulling on administrative health data that was often collected in sort of a monthly way. So things like use of the cardiovascular template in a month at a given site. So we were getting some quantitative data that was then interesting to integrate with the reflections, and we'll come back to talk a little bit more about that later as well. But one of the nice things about laying out the methods this way is you can just really see how these different time points might inform one another, which can be helpful and provide a much more dynamic view of what's happening. If you're really getting kind of provider interviews before and after, you're definitely going to get some wonderful insight about the change between baseline and post-implementation. But you may miss out on a lot of the ups and downs along the way of implementation itself that would be really revealing and important to understand if you're going to be moving this intervention into other settings later on. We don't have to go through this whole slide, but I went through and reviewed a number of the newer protocols that are using periodic reflections as part of their study design to see sort of how people are using them. And these are a few examples. There's more out there, but I will say the extend query right now is also using reflections. They are using them some monthly and some quarterly. I think they're doing monthly with implementation team coordinators and then quarterly with PIs. And they're actually using these in a different way that we'll talk about a little bit more later on, but they're using them in an ongoing way where they're continuously doing analysis and then reporting back to the implementation teams in order for that data to inform process evaluation implementation itself. So they're not really treating them from retrospective analysis. They're really using them in an ongoing way as part of implementation. So they've been using them to inform implementation planning, select their implementation strategies, and also kind of keep an eye on what are some of the contextual factors we need to watch as we're starting to put these into place. So that's been very interesting to learn from how they're doing that. Lauren Penny also did periodic reflections as part of the hospital to home study, and was using those less periodically in the sense of having a regular schedule, but when moments of key transition or transition between phases of the study were occurring, and using them to document events and activities and why certain decisions were made, and some of the key challenges that arose. There's a beautiful new protocol from Baden Simmons on state level access to contraception in Utah. It's a great protocol if you're interested in looking at protocol papers. It's a really lovely example of integrating qualitative and quantitative work in that kind of a state level program. And they're using reflections to look at implementation context and how the intervention was implemented. So they're looking specifically at fidelity and adaptations. And they're also trying to use them as part of looking at their mechanisms of impact for understanding sort of how things worked in different settings. So I thought that was fascinating. I'll be really looking forward to seeing their results. And then you see in other places, again, more sort of consistently using reflections to look at how implementation is going, what kind of adaptations are happening in different sites, particularly unplanned adaptations, and then looking at kind of real-time barriers and facilitators as they're arising. And again, kind of contextual factors impacting implementation. So you can see, if you look at kind of the implementation goal, each of these studies has tailored the periodic reflections to meet the needs of their study in terms of when they're doing the timing, who's participating, and then how they intend to use the data. So I thought that was really nice to see. And then I'll say one more thing, and then we can kind of pause and take some questions. But there's another study I'm involved with, and that's the Transitioning Service Member Veteran Sponsorship Initiative that's led by Joe Geraci. And this study is absolutely fascinating, and it involves an ever-growing number of partners. It's a multi-sectoral suicide prevention initiative, and it really does not work without a lot of hands working together. What has been interesting about that is we've been using periodic reflections as part of the program evaluation design for that. And they have been vital because it's such a rapidly moving initiative, because there are so many partners and moving parts. I really don't know what we would have done without the reflections as a way of centralizing the documentation for how that has continued to evolve. So that has been a real learning experience for me. I will say this program evaluation is kind of a classic hybrid 2 implementation effectiveness design using a REAIM framework. So it fits into a lot of the normal types of work that we do. It has just been much more rapidly moving than many of the initiatives I work with. So it's been really interesting to see how reflections work in that environment. And what we've done there, because it's such a large team and there are these relatively independently functioning teams, we've set it up so that we have monthly reflections with the PI, Dr. Geraci. But then we also have bi-monthly reflections with the key leads on all of the different teams. So we're able to get that big picture view of what is happening across all these different teams on the ground. So that's been really helpful as well. Okay.
Erin, so, I'm just gonna interrupt you for 1 second. A few people lost Zoom. I've also heard that a lot of people can still hear you and are still on, but there was some technical glitch. I've had a couple people let me know that they had to call back in or that they lost Zoom. So I think folks are getting back in, but I'm just keeping an eye on it, just so you know. I think we're okay to keep going, but just so you know, there seemed to be some little technical glitch.
Oh, that's too bad. Okay. Is there anything we need to like pop back and re-note, or are we okay?
I think we're okay. And while I'm talking, I'll just note that we're not able to put a link to the slides in the chat. So Elena's in the process of sending the slides in PDF to all of you. So you will be getting those. And she just mentioned that in the chat as well. So they're coming.
Okay, great.
All right, thanks. Sorry to interrupt.
No, not at all. This is actually a perfect spot. So this is kind of design take homes. We have found periodic reflections to be pragmatic, pretty low burden, and a nice, just kind of handy way of capturing emergent data during implementation. They work really well as part of a well-integrated mixed method evaluation plan. And one of the nice things about the method is the content, the timing, the participants, and strategies for analysis can all really be tailored to the needs of the specific project and also the theory or model or framework that you're using to organize implementation. So they're really handy and flexible. But that's a good stopping place. Are there other things besides technical difficulties that we should take a moment to reflect on? Or
one question that came up, but I know you're addressing it later, is how do you explain this for IRBs when the implementation team members are also acting as the subjects of research? So I know that you are going to get to that a little bit later, which I told Ellen. So, and if she has more questions after you get there, we can follow up. And Jane said, in the bi-monthly reflections with key partners, were you talking to them individually as a group? Are you interested in group understanding or individual experience?
Yeah, what a wonderful question. So we can talk about that, and I think it really, we'll talk some about participants, but it does vary by project. Trying to think whether there's better, maybe let's come back to that because it's such a good question, but definitely want to understand both individual experience and group dynamics, where the group dynamics are helpful and relevant, which is almost always, right? It's a wonderful question though. And again, I think something that can be tailored for the study. I mean, if understanding how the team works is very important to the work that you're doing, that is certainly something that can be looked at in these as well.
Yeah, that's interesting. I don't, correct me if I'm wrong, I don't think we've done as much analytically about the group understanding, like looking at the reflections for that group think aspect of it.
We've done a little bit on sense making and sort of group sense making, but not a lot. Yeah. That applies more for some teams because some teams function more in a teamy kind of way and others function more in a sort of individually led kind of way. So that varies too. But
yeah, and it's interesting to think like, how would you, if you wanted to be really intentional about that, really intentional about the group think that is part of the reflection sometime, like what implications might that have for your design? You know, so like we tend to be pretty flexible in terms of sometimes the reflections are with an individual, sometimes they're with a smaller group, but I could see how you could actually, you know, kind of build that in a little bit more specifically if that's something that you really wanted to highlight, especially if you're doing this with like a little bit beyond the research team members and doing it with some other stakeholders. So it's a really interesting idea.
It's a great idea, and maybe I'll stop there and do a plug too. We're in the Alison and I and some other colleagues are in the process of putting together a special research topic for Frontiers in Health Services, looking at the role of power and relationships in implementation, because I think those are both really underexplored in the implementation research literature. But I think this question of how relationships function to support or inhibit implementation is a really fascinating one. So if you are primed to do work in that area or have already done work in that area and can point us to it, I would really love to see it because I think it's very, very powerful. And I just haven't seen a lot of work in that area. So, and if you're interested in that special issue, let us know because we can link you to it as soon as the announcement comes out. Okay. I give everybody a little breather.
Everything's good on the chat side.
Okay. Okay. Let's talk about doing reflections. So I think for a long time when people were asking me kind of who's the right person to do reflections, I think I was maybe a little flippant. I was sort of thinking, it's not that complicated. We get these things, we have these conversations. It's all very nice and friendly. It's great. But I think the more I have reflected on that, I think actually it is very helpful to have a discussion lead who has some basic skills in qualitative research and implementation science. The discussion template itself is very straightforward, and you'll see that shortly. We'll go through it together. But partly because it is such a flexible method, I think that does put a little bit more onus on the discussion lead to be thinking all the time about how does this conversation connect back to the key questions and goals of the work. So you do have to be kind of mindful of what are the questions that we are trying to answer and what are our core goals in this work. So it's helpful to have that in mind. The content questions are open-ended, so it's helpful to have a sense of kind of when to prompt. So if adaptations are a particular focus, you're going to want to be prompting a little bit more on adaptations. If implementation strategies are a little bit more of a focus, you're going to be wanting to prompt more on implementation strategies. And those are certainly things that can be built into the template as well, but just being mindful of that. So I do think having some background in implementation is probably a prerequisite for getting the most out of these. And then I think always when you're talking about a qualitative research method, just having some basic training and kind of reliable, rigorous data collection and management is going to apply here as all other qualitative methods. Another thing about the discussion lead for the reflections is, and these all go along very much with facilitation, but just being able to discuss implementation with participants who are thinking about it in very different ways. They may have different levels of power, they may have different levels of expertise, they may have different levels of buy-in. They may or may not be necessarily on board with spending that time with you on a regular basis. So really being able to meet people where they're at and translate why this is an important activity is important. I think facilitation skills are life useful for being able to identify when there are moments when maybe the team, if there's a team involved, they do need a little bit more dialogue, or when information that you're learning in the reflection may need to be shared with other members of the team. And we'll come back to that a little bit because that can be kind of a challenge in certain moments. The other thing we've learned is one of the great things about reflections is because you are coming back to the same folks over and over again over time, you do have that opportunity to build up a lot of trust and a lot of one of the nice things about after you've been doing reflections with a team for a while is you don't really have to say very much as the lead of the reflections because they know the sorts of things you want to hear about, and they can just sort of talk through those things, and it's wonderful to get to hear all of that. But because you're coming back over and over again, you do have the opportunity to create a lot of psychological safety. You have the opportunity to create a lot of trust, and you also have a lot of historical knowledge of the project. So you can ask those follow-up questions about, is this now I thought we were doing this, how did that happen? And how did we end up over here doing this and that sort of thing. So I really do tend to recommend having the same lead for a given project or team as much as possible, because I think it really facilitates those good, deep conversations, and also understanding where changes may have occurred that some of the participants might not have noticed are changes, or they happened a while ago for them, so they're not thinking about it in the same way.
Erin, can I just make a comment there?
Please.
Because it struck me when I was looking at the slides yesterday too, yeah. These issues of trust and psychological safety. I would just say from the perspective of a reflector, one who has been in these discussions with you as the person reflecting, this really can't be overemphasized, because it does, at least from my experience, it does feel like a pretty intimate conversation. And I think, that has a lot to do with how you lead them. But, you're really getting into the guts of what's happening in implementation. And it really does require feeling comfortable with the person who's leading, feeling, like they are going to have a good barometer of confidentiality, that they're not, of course, in any qualitative methods, we want to avoid folks feeling like they're being judged or, anything along those lines. And that's just been such an important part of this dynamic, I think, in these discussions, is knowing that it is a safe space. I don't mean that to sound at all hokey. It really is true, because, when we're sharing, things that go well and things that don't go well, it's very important that the folks you're sharing that with, the discussion lead, if there are other people that are part of the reflection, that it really feels comfortable to be able to do that. And so I think I was going to say in my notes to you, maybe we should like bold that or something, because it is really to me, it's a really important part of what makes this work, is that it's a safe space. It's a place where you trust everyone who you're doing it with, whether it's 2, 3, 4, that there's a lot of trust there.
Mm-hmm. I think that is a super important point. It's funny, it reminds me of, we were having conversation at another time about medication errors. And the only way we get better at handling medication errors is we have to report them, and it has to be safe to report them. It has to be okay to say, I made a mistake, so that you can stop and say, okay, what's happening here? And how do we think about this? And what can we do differently next time? Right. And this is similar in the sense that part of what you're going to end up talking about is all the stuff that goes wrong. So if the people doing the reflection feel like they have to be performing how everything is great and it's all going beautifully, then you're not learning anything. So it really does have to be a space where it's okay to be like, oh man, we thought we were going to have this done 2 months ago and it's not, and we're really stuck. And you know what, maybe we can try this other thing, but it's been really hard. So I think making that point is really important. And also, when we get to analysis, being on the receiving end of that kind of trust, you want to honor that in how you use the data. And that raises some different questions. So maybe that'd be a good thing for us to come back to when we get to the analysis. It's just, what is the ethical responsibility for how you conduct your analyses in a way that maintains the safety of people in the team, while also meeting the goals, which are to learn from implementation so we can do it better next time. So it's great, very interesting stuff, but I think that was an important thing to pull out. So I'm glad you did.
Yeah, it's the word that comes to mind is unfiltered. It's an unfiltered discussion, whereas, when we're doing interviews, they tend to be filtered to some extent. And so I think your point about analysis is really important too, because you and whoever's analyzing this data really has to think about, what is appropriate to filter in and what's appropriate to filter out. And sometimes there are going to be important things from those guts of implementation, the things that went wrong, that are going to be very important to understand implementation, but can they be sort of lifted to a broader level, or a sort of more general lesson learned type level than probably it came out in the context of the reflection in that more kind of undistilled version. So yeah, it's really interesting to think about that.
For sure, because it's not like we can remove PHI and give confidentiality. You have to be much more attuned to who is going to be visible in what, and how do we do this in a way that's, again, supporting the movement forward, but in a way that doesn't undercut anyone, because that's never the goal, for sure. Well, let's come back to that. I want to make sure that makes sense to folks once they've had a chance to see some more, for example, examples of kind of what kind of things come out in reflections. Definitely happy to talk more about that. In terms of the participants, okay. So we have done these in groups. I've done them with one person, or we've done them with one person, we've done them with small groups. I have tried doing them once with larger groups, and it was not very successful. I do think these work much better in smaller groups, because they are intended to be kind of a, okay, we've been doing this, this didn't work, this worked kind of conversation. And as we've been discussing, that really does require some openness. It requires some time to talk. It requires some psychological safety. So I do think smaller tends to work better. You definitely want people who are closely involved in the implementation effort, so they're in a position to describe what's going on in terms of activities and challenges. So that's typically going to include the leads or members of the centralized implementation teams. For example, the PIs, often co-Is, project managers, site liaisons, champions at the site, facilitators, folks who are really in a position to sort of see what's happening, either at the big picture in a centralized way or at the site level. It may also, and then next bullet, may also involve some site level champions or key staff, but folks are going to have an ongoing role. Maybe they don't have a role through the whole course of things. Maybe they're really only involved in one phase, but they're going to have enough of a role that contacting them multiple times really does make sense. And then kind of getting back to this point that the key individuals may vary over time by implementation phase, the site involvement, the study phase. So there may be a time, again, when a site is involved for, say, 18 months. So that's going to be the time probably when you're working with them and kind of run up, and then maybe again afterwards. But that will be a period of time. But maybe if it's a 4-year study, maybe you're not talking with them the whole 4 years. So you can be thoughtful about who's getting what reflections at what periods of time. And then getting back to this issue again of psychological safety, there may be times when you want to hold separate reflections with someone based on their role or based on power differential. If there are folks who maybe don't have a lot of power in this particular scenario, maybe you want to hold a reflection with them separately so that they really have the freedom to talk. Or maybe it's a good time, if it's a small group, maybe that can be a really useful time for them to talk with their PI or someone else with a higher power in that scenario too. It just depends, but being mindful of what's going to set people up to really be comfortable and for positive experience for everybody. Because again, these are reflections that you're going to be coming back over and over and over again over time. So people need to be comfortable and you need to feel like this is a good use of your time. So they have to be set up that way, and it has to be maintained that way.
I have a question for you, Erin.
Yes, ma'am.
Not as from me. Have you ever had the experience of doing a reflection with more than one person, but feeling like someone in it was kind of holding back, maybe because of who else was there and following up or thinking about following up or anything along those lines? Just again, thinking about these power issues and the safety, etc.
It's such a good question. I don't think I have, because I think we've been, knock wood, thus far able to kind of be attentive to that ahead of time. But it has struck me as something to be really important. So far, so good, no. But I can certainly imagine how if that came up, it would be appropriate to think about it and follow up with them and make sure that if maybe they do need a separate reflection time or that's set up to make sure everybody's in a good place.
Mm-hmm. Thanks.
Now I'm going to worry about that. We got to make sure that's okay. Okay, so timing. I've said this a number of times. You really can. I do think the repetitive nature is important, but it can be monthly. It can be bi-monthly. I will say I haven't tried it quarterly. We've set that up for a new project. I'm going to be curious to see how it works. I think it will probably work fine if you have the same person coming back quarterly over a period of a year or so. That's probably enough to get people comfortable with the format and comfortable with the lead, and that this is okay. It does usually take people a reflection or two to get used to the format, because it's not like an interview in that you're asking a lot of questions and getting an answer and then you move on to the next question. It leaves more room for the individual to talk. So getting through those first couple where they understand what it is that we want to hear about can take a little getting used to it. So those would be my thoughts on the periodicity piece. As somebody raised the question about how often do you need to do these when there's a lot going on? Again, it has to be low burden. It has to be pragmatic. It has to be realistic for the team you're working with and how many million other things they have on their plates. So it was always intended to be real world useful. So you kind of have to work with your team to figure out what's most useful. We find monthly works very well. That gives people time to do a lot of things often when things are busy, and then come back and tell you about it. And it's still within a period of time they can remember the big stuff. There are going to be team members who maybe need to be involved all the time. There may be team members who only need to pop in here and there. And again, that can be flexible to the needs of the team. Some phases are going to be more active. Pre-implementation tends to be really active. Launch tends to be really active. And then once things get stabilized, maybe you don't need them quite so frequently for a while and you can pull back a little bit. They certainly can be time sensitive to events. Sometimes you're going to have something that changes really quickly and you need to document that and make sure that that's captured, because that's going to be really important for the implementation. But as I've said before, you really do have to be mindful of burden and you have to be mindful of buy-in. The goal is always to support the work. It's not to drag people down. So just really trying to balance that, needing that close level of the data in order to be able to understand what's happening, but also not taxing people, because the whole purpose of this method was to try and find ways to get closer to what was happening, but without adding more to the plates of very busy people. Well, Alison, is there more you want to say about that?
I was thinking back to when we were like, should we call this monthly reflections or periodic reflections? Because monthly was not always possible. So that's where we landed on periodic, like every 4 to 6 weeks or so. Yeah. But a question came up that I think is it's good timing for where we are right now. So Alyssa said, I'm wondering about strategies and protocols around how to facilitate info sharing across team members or units. If it comes up in a reflection that some key sensitive or vulnerable info isn't getting out to the relevant stakeholders, in your experience, how much does the discussion lead help identify strategies for safe ways to disseminate?
That is such a good question. And that is one I would love to hear more in the chat if folks have thoughts about that, because that is not one that I feel like I have a pat answer for how you do this. I really feel like, again, that we're going to talk about a little bit more about this later on, but some of it depends on what the team wants. Some teams really want these to be purely part of the evaluation. So they are something we will look at retrospectively. We will use them as a way to understand how implementation went, but they are not intended to inform implementation. Some teams want regular updates on how things are going, where there are problems. And those teams are going to want a lot more of that information. For myself, I have tended to follow kind of the ethics instilled in me as a methodologist around trying to make sure that confidentiality is honored, but there's no opportunity for harm. So if it seemed like it was an important time to share some of that information, then I have done so. One thing I would recommend, and I think I say this later in the slides, is making sure on the front end that everybody's clear about how this information is going to be used, so that when you're starting the reflections, you're saying, yeah, this is really about, we want to understand what's going on. We want to hear more about what you're doing, where you're running into challenges, etc. Most of the time we'll be reporting in a general way on this back to the larger team. But if there are specific issues that come up, there may be a time when we really need to involve the PI and talk more actively about this, or whatever the rules for that team are going to be. But I think my biggest guideline would just really be trying to set up ahead of time so it's clear to everybody this is really safe space, but if there are challenges that are arising that have implications for the team, we're going to have to talk about that as a team. I suspect there's a lot of room to fine tune and make that guidance better, though. So I would love to hear more from the team. Alison, what else would you add to that?
No, I mean, I feel like it's just such an evolving part of the method, because I know we had the experience a few times of, you hearing in reflections, here are some things that are going on in the sites that I didn't necessarily know. And that really came about because of the reflections, which I think, confirmed their, at least parts of their utility, which have been, other parts have been confirmed in other ways. But I remember there was a point at which we were like, oh, we're we're there. We have to think about that. We have to think about how do we take what we learned from the discussions, and are there going to be situations where we're more proactive about that information because it actually could impact implementation. So sort of like what you're learning that's a backdrop to implementation, and then there's things that you're learning that are very much related to what's going on right now. And so I think that's just been such an interesting part of our work with this, and just seeing what comes of it. I mean, when you're trying something new, you never quite know what all is going to emerge, and that was definitely one of the more interesting kind of unexpected discoveries that I think was a very helpful discovery. Oh, this is actually an opportunity to potentially identify issues. So I totally agree with your perspective that that requires that thoughtfulness and transparency up front, so that everyone knows. And then I assume, even in the context of doing the reflection, that it might, the lead might say, that might be an important thing for the rest of the team to know, so they know, like, there's a little heads up that is, still maintaining the confidential dynamic, but saying, that's probably going to be something that we're going to need to talk about as a team.
I think so. And ideally, yeah. And I will also say later on, I'll show an example of one way where I have one team that has requested that we specifically report back on problems, but consistently across everybody. So it's not anybody's getting singled out. It's, we know we got a lot of things going on. We got a lot of challenges here. Let's name them so we can work on them together. And so I've developed kind of a format for how to do that. And we're trialing it. So I can't really report at this point how well it's working, but I know other folks have used reflections in these ways. So folks in the chat, if you have lessons learned about this, please pipe up and share, because again, this is something we're all learning about as we go. But I will say the first time that happened, that really caught me off guard. I had not anticipated that. So I've been learning a lesson for us.
And Elvira said for H2C, it helps understand how the teams were understanding a more fluid intervention.
Yeah, that makes a lot of sense. And have you guys written that paper? Would you please? Because I really want to read it. If you can. Okay. Okay, we'll keep going here. I guess we're doing okay on time. Logistics, this is kind of the nitty gritty, not super interesting, but helpful, hopefully stuff. So we use a telephone or a video meeting. When, of course, when you're new to somebody, it's nice for them to see your face and know you're a person. That's always helpful. Recurring calendar invites with the telephone number or meeting link are critical. Again, we're asking busy people to introduce more things into their schedule. So the easier we can make that for them, that is really important. Again, I try to lean short, but particularly if there's a project where a lot's going on, sometimes they end up being 60 minutes. I really aim for 30 or less if there's not a lot going on, but sometimes they need to be 60 minutes and people just have that much to say. So that's great too. And just, it's always useful to check what was the date of the last reflection before you start, so that you can remind people, okay, when were we talking last? And also kind of helpful to remember, what was the kind of key stuff that was going on at that point, so that they can kind of mentally go, okay, that's where we were. We need to just sort of start from there. Those are just helpful things. In terms of logistics, I will say we really started out doing these as notes and kind of as near verbatim notes. So kind of as quickly as you can get the gist of what's being said in a more narrative way. That has been the goal. There is one project for which we have started transcribing them, because again, there's a lot going on. There are a lot of moving parts. And it's been really helpful to have those transcribed, because we needed a finer level of data for those. So I think it's a choice about what fits for the project. Obviously, if you're starting to transcribe, that's going to increase some of your time and resources. So I think it's perfectly fine to use them as notes. That's still how I use them most of the time. But that will also be something you want to think about in terms of how do we want to analyze these? Do we need notes for this, or do we need transcription for this? But this is kind of a fictional sample, but of the kind of notes that we'd aim to take. So really trying to get it as near verbatim as you can, but understanding that this is not the same thing as a transcript. And then just data management. These are basic things, but they are really helpful. So keeping your naming conventions consistent, particularly if you have multiple people doing your reflections, and trying to make sure you've got your project noted and your date, because the dates are always going to be really important for analysis. Having a centralized storage space that is appropriate, having a master tracking file where you're able to quickly look and see, okay, what do we have in terms of the reflections? What were the dates? Who are the people? What are the roles? Who was leading that one? Was there a note taker? Sometimes a discussing lead will also take the notes. Sometimes you have a separate person. Just kind of depends on what you have in terms of resources for the team. And then if you are transcribing them, has that been done yet? Again, most of the time I do not, but that is an option. And then here we get to IRB approvals, and I'm happy to talk more about this if people are interested. I will say a lot of the time, if it's just the implementation team only, or if it's a non-research project, we don't necessarily approach it in terms of IRB approvals. We haven't done that always. There are times when involving site level personality in a research study, it can be required or it can be preferred, just to make sure it's very clear to everybody what the guidance is and what the communications need to be regarding how data will be used. So that can be useful. Again, this is something where I would really welcome feedback from folks in the chat about how they've done this. But we have done it both ways and found that it worked just fine both ways. Alison, is there more you will want to say about that?
I mean, it's, we can never really account for all IRB preferences and, requirements and guidelines for this. Yeah. I think some of the determination, really comes down to what are you using the data for? Mm-hmm. And, if there are any doubts about whether it should be an IRB approved data collection activity, I would definitely inquire and not assume that it should or shouldn't be, because you never know. But yeah, we have not historically, at least in Empower, we haven't, we aren't consented to be reflecting that type of thing. But I could see how it could be different depending on who is going to be doing them, and again, what's going to be done with the data. Yeah. And just so you know, Katie just mentioned with regard to the transcription issue that she's had good luck with REV, that does quick and cost-effective transcription. I'm quite sure we wouldn't be able to use it in VA, but if you're not in VA and that is something you want to check out, I can actually put it in the chat for everyone in case you want to take a look. That's great. I think we're all always happy to find great transcription services we can use. So recommendations, welcome. Thank you. I think it was Ellen who brought that up. Any other questions about IRB while we're here before Erin moves on? I'm not seeing any in the chat so far, but just want to make sure folks have a chance to ask if there are any other questions there. Okay, none are flowing in, so I think we're okay to go. We can always come back to them if they come up again later. Okay, so this is just kind of getting into the content of what these look like. And again, this can be tailored, but let's talk through a little bit what the standard sort of looks like. So getting started, as I said earlier, this isn't necessarily quite the same as an interview, and people aren't always familiar. So I try to make sure that leads are always really explaining in the beginning kind of what this is about. So we just write on the form, so it's always there to go back to. These reflections are intended to provide an opportunity to check in regularly about how implementation efforts are going. Our main goal is to take a few minutes to discuss and document and reflect on key activities and events and changes that are occurring over the course of implementation. I'll be asking a few questions to get the conversation started. Are there any questions I can answer for you before we get going? So that's sort of our standard opener. And then we always document the date and the participants and their roles, and then who's the lead and or the note taker.
So kind of basic logistics. And then the key questions, if it's somebody's first time participating in a reflection, we do always ask, do you mind telling me a little bit about your background and your role for this project? Because that can be really important to understand and gets things rolling. And then I will say the bulk of the time for most reflections is spent answering the next question, which is really just what are the current main activities for the project and how's it going? Once folks have gotten used to the fact that you really just want to know what they've been doing and working on and worrying about, you can usually get pages and pages of answer to this question, and that's great. And that's where, you know, a huge amount of the meat of what we do ends up coming out of this. I will say after a few reflections with a person or a small group, we rarely seem to need to ask the next two questions, but they're important we keep them there. So these are about, have there been any changes to the intervention or how it's delivered in the past, month or so, or whatever your period is? Have there been any changes to the implementation plan or activities in the past month or so? So really trying to get those questions about, have there been adaptations to the intervention? Have there been adaptations to the implementation plan? Again, after a certain amount of time doing these reflections with folks, most of the time you don't need to ask. They sort of already are answering that question for you, but those are important and useful, and is particularly if you have a particular focus in that project on adaptations. So those are key questions as well. This question about, have there been any stakeholder engagement or outreach efforts in the past month? That is another question that I will say I rarely have to actually ask, because it turns out that a huge amount of what we do in our activities and implementation really are about stakeholder engagement and outreach. So that's something that comes up very naturally, at least in the projects that I've been involved with. So that tends to come up very naturally, but again, it's a great thing to ask if you're not already hearing about it. I almost always ask the question about, have you seen any recent changes in the local or national environment that you think may have impact for the study? That is one that folks don't necessarily think to answer without being prompted, even if they've been doing it for a while. So I always try to come back to that study, because it's pretty frequent that people will say, no, not really. And then they sort of stop for a second, and then they come up with something really important. So I think that has been a really important question to have in there as well. And then we always come back to one of the last questions we always ask is, what are the next steps going forward? And that's a great opportunity to sort of stop, go over all of the information that's been shared in the reflection, and then sort of coalesce, okay, what does this mean in terms of what the next steps need to look like? So we've found in terms of, this one gets a little bit more interventionist, and we can talk about that as well, but in terms of supporting team sense making around the work and where the work needs to go going forward, that can be a really helpful question. And we also include on the template a number of optional prompts, and these are particularly useful for folks who haven't done a lot of the reflections or haven't gotten used to the format yet, or maybe are just not quite as chatty, and that's great too. So we keep these in terms of, are there any barriers or concerns that have come out recently? What solutions have been tried? How's that going? So problems come up, we try solutions. How are they working? Who have been the key people involved in recent activities or discussions? And what have been the concerns or their hopes or suggestions? Have there been any surprises lately? Have there been any unexpected events? Because this is the sort of thing that this can be particularly useful for. What lessons have been learned, and are there any remaining thoughts or observations or concerns? So those are the things we really want to know. And if we need to ask and probe a little deeper to get those information, it's useful to have those prompts there. So we keep those there. And then talking a little bit about potential adaptations. These are all adaptations that I have either been involved with teams doing this, or other teams have told me that they have used. So tailoring core questions to meet project needs. So for one project, for example, this past year, we added a specific question about COVID and the impact of COVID on the work that folks were doing. So that was really important for this team because that had shut down a lot of the work. But just making sure that whatever content changes are related back to answering the core research questions or the core questions for a particular initiative. Another team uses a tabular format instead of like a Word document format because they think that facilitates note-taking and analysis a little bit more easily. I think that's great. That can be a really another nice way of doing this. And then in terms of another option and something else we've done for another project is we've added in a couple of quantitative questions to support tracking of progress along particular metrics and milestones. So we've added in a question about, we asked the teams to identify ahead of time what their key milestones were. And then we ask each time sort of where are you in terms of those key milestones so they can reflect back on those. And we also ask them to identify ahead of time their recruitment goals. And then we check in periodically on where are they in terms of the recruitment goals so we can understand how that's moving. So you can certainly add in quantitative questions as well. I would keep it relatively minimal because the focus is really about the reflection and getting the more thoughtful data. But it can be a really nice complement. So there are a lot of ways you can adapt the content as well to meet what you need for that specific project. This is kind of a good stopping place as well. So maybe I'll run over through some of the take homes here and then we can answer any more detailed questions folks have about how to do this. So one of the things we really like about the reflections is their flexibility in terms of who's participating, what's the content of the discussions, what's the timing, when are they being collected, how is the data recorded. So they really can be used in an awful lot of different ways for different projects. I think they work best when you do have a lead who has a pretty good working knowledge of qualitative methodology. So the folks on this call, since this call is really strong folks in qualitative methodology and implementation science. I do think there's a lot of gain from keeping the same or really consistent leads for a participant or team or site or project, kind of depending on what your unit is, but trying to keep those relationships as consistent as possible. And also that these really do require open and honest communication. They require the participants to be committed to the process over time. So it is important to ensure that they have a lot of safety, they have a lot of trust, and it's as convenient as possible for them because this is a generosity of theirs in making this work. So those are some thoughts there. Let's stop and answer some questions and chat a little bit.
So one follow-up question about IRB from Ellen was, if you're not getting approval, does that mean you're not planning on publishing the reflections data? So I just clarified from my perspective that it's, at least in our work environment, it's usually more a matter of, we have a determination of non-research for several different components of the study. And so we can publish, but we have to just say we have a determination of non-human subjects research. So depending on what you're asking people about, some VAs and who you're asking, again, what the goal of the data collection is, you can, it could fall into that non-human subjects research realm, but anything you would want to add to that or change about that, Erin?
No, I think that's really nice. And that was a much better way of saying it than I said it earlier. I like that. That's perfect. Yeah.
And then there was just a broader question from Lillian about how effective is virtual ethnography?
Oh, what a fabulous question. Discuss. I would love to hear the group discuss that. I think it can be very effective in lots of ways. Gosh, wouldn't it be even better though if you can get there, at least in the beginning, to really get grounded in the setting, get grounded with the people, and then follow up virtually would probably work best. But I'm not remotely prepared for a proper conversation about that, but it's a fascinating question. I would love to hear what Lillian thinks.
Yes, Karen said over the past 17 months, probably super effective.
Right. The world has changed to support.
Yeah, and it's another, innovation turn that I think we've had to take. And, I think we might, or at least I, speaking for myself, might think about what we can't do virtually, but it's also really helpful to think about what we can do that maybe we haven't been able to do otherwise, and what opportunities are opened up when we're doing things virtually, especially with regard to, convenience, accessibility. So I think there's so much to the Karen said she couldn't resist. That's Karen Drummond, our friend, by the way. But I think it's, it's going to be part of, this is just my little editorial, but I just think it's going to be part of what we have to accommodate, for the future. I mean, probably forever, doing this. So we kind of have to figure out different ways to be comfortable with it and to make the most of it.
I think so too. And it's so interesting because, we talked a lot when we were first thinking and writing about these in terms of, are these ethnography, are these ethnographic, are these ethnographically informed, and what are the gradations of therefore? And, what we kept coming back to was they're not ethnography exactly because they're not in-person observation. And I think that was a solid distinction. However, as the world has changed around us in many ways, and what it means to be at a site has changed because the sites themselves are now often disparate and not located in a single place. And we are not located in a single place, and all of that. I think you're right. I think it's opened up new opportunities for thinking about how do we work with what we have to learn as much as we can.
And Kenda said, hello, Kenda. I suppose virtual ethnographies make sense for our virtual world. Also, there are pre-COVID examples of ethnography conducted in virtual spaces like Second Life.
That's a great point, right? And that was something that had been going on for a long time, that kind of work. And there's probably a lot to be learned from that work. Oh, that's a great example.
Yeah. So yeah, we're in a good spot with the chat.
Okay.
So thanks everyone for your contributions. Keep them coming.
Yeah, definitely. Okay, so that's kind of getting everybody on the same page about what are we talking about, kind of the nitty gritty and whatnot. Again, happy to answer more questions about that as they come up. Hopefully the slides will be a useful resource for that. And then if you have questions that come up when you're doing them, you know where to find Alison and I, and we're happy to answer more questions as they come up over time. But I've got our emails at the end, but this is kind of the fun part. So now we can talk a little bit about kind of what are the kind of things you can learn from these data, how have they been analyzed, what are some different options for that. So let's talk a little bit about that. And I will say that the recurring theme here really is flexibility. So we have worked with these in ways that can be ongoing, they can be periodic, they can be retroactive. In terms of when you're doing the analysis, are you doing it the whole time? Are you stopping at certain moments to look back, or are you sort of waiting till the end? They certainly can support formative or process evaluation, and we're going to talk about some examples of that. Reflections data can absolutely be coded using inductive or deductive strategies. I have really mostly done deductive, and we're going to do some examples of that as well. We can also use more of a case study approach. You can use rapid qualitative approach. We find them to be very compatible with a lot of different theoretical frameworks. They're themselves theoretical, so you can use the data with different frameworks, and that works beautifully. And you can also do sort of solely qualitative analyses or integrate them more with a mixed method, a plan. So we're going to talk a little bit about some different things there. So I will say the first way we ever use them, and I have found this consistently works pretty well, is kind of deductive coding. So we started out doing some coding for things like really grounded in complexity science and grounded in some of the dynamic sustainability questions around dynamic implementation ecology. And, you'll find they're not quite quotes, right? Because these are from the notes and it's near verbatim notes. They're not exactly quotes, but things like there's change in the climate around doing remote delivery of healthcare. This is almost funny to listen to now. I think this was said probably about 2018. So it was a different world, which I think VA is increasingly interested in, different than 2 years ago when we submitted the project proposal. So this was a case in which they were talking about doing an online version of an intervention. And when they'd first proposed it, there had been some initial resistance. So they ended up doing a comparison of kind of online and in-person options. And of course, now we know that a lot of care can be delivered online, and we were forced to adapt to that. But at the time, it was starting to be able to see, okay, we're seeing this change. And it's happened since the time this was funded initially. So that was one example. I really do continue to appreciate the way that reflections can be useful for seeing adaptations to the intervention that the folks doing the intervention may or may not recognize as adaptations. And I've seen that happen a number of times across projects. So this is an example where they had women in these in-person groups together, and the coach leading these groups said, you know, I could just cry how wonderful the sharing between the women in these groups is. It's pretty amazing, the relationships that have been building the last couple of months. What are we going to do when this finishes? I hope they have an opportunity to meet. So the PI was reflecting on that and saying, you know, in the past, we've done maintenance groups once a month or something, and we can do that if enough people were interested. And as it turned out later on, there were enough people interested, and this was something that they did because this group of women had just really gelled in supporting one another. So that was an adaptation that was made to that intervention for the course of the study. So sometimes these adaptations do occur. They are not necessarily planned. They are much more responsive to what's happening in the environment, and that's great. And this can be a nice way to catch that. We also do see kind of the opportunity to document and capture some of these adaptations to the implementation plan. So the other thing that we developed, they're talking about here, was that we ended up having to have a communication plan, the marketing strategy. So that had not been initially part of how the PIs were planning to approach this implementation, but this was something that was clearly needed pretty early on. So they made a rapid adaptation to the implementation plan for that. So these are just pretty simple examples of how you can use deductive coding with these data, and it can be quite helpful. I will say the example I really like is this one, which is from a paper that came out in 2020 last year. And it's just, if you haven't gotten to look at it, it is a great paper, and they're comparing sort of shared and unique implementation influences across 2 different community services systems for autism using the EPIS framework. And they used interviews, but they used them in a periodic way. So they refer back to periodic reflections, but I think they probably introduced some of their own content. But they analyzed them in this way that allowed for sort of the repeated interaction with folks over time. And they came up with a much longer list than you see here of these different EPIS constructs from the EPIS framework that they saw emerging in these data. And then they coded them for whether they emerged as a barrier or a facilitator, and which systems they popped up in and which systems they didn't. So they were able to do this sort of really nice comparison of the 2 and see what was unique and what was shared. I thought that was a great way of handling the complexity of trying to describe some shared things across 2 separate systems. So that's a lovely example of working with those data and using kind of a deductive coding framework. I will say, in terms of sample coding, we have treated these data in a number of different ways. We've worked with CIFR in terms of the coding, working on an analysis now using the ERIC implementation strategy taxonomy. So we were working on something that's relatively early on in its stages, but it's been very active. So we went through and did an analysis of the reflections to pull out all of the separate implementation strategies. And we did some independent coding and verification and all that normal stuff, and identified 19 strategies within the first year of this project using ERIC, and that worked really well. I will also say we've used Frame for categorizing adaptations, and that's been very helpful. We're playing now with using Frame implementation strategy, the newer version, and focused on implementation strategies as well, so that works fine. We've certainly used complexity science in coding. I just showed an example of working with EPIS. I think you could do it with IPARIS. We've done some other stuff with health equity implementation framework. So we've just found it to be very flexible and amenable to different theoretical frameworks. So that's good. It leaves us some flexibility. Okay, so another thing that's really lovely about these data, and this is just a very brief example, but just to sort of ping that this is possible, is they give you the opportunity to come back to the same site or the same people over time and see how their relationship to the intervention changes. And so much of implementation is about changing people's relationship to the intervention and moving towards normalization and creating that as part of their routine practice, that this is a beautiful window into how that can go. So this is just a very shallow case study, but as an illustration. So this was from the Collaborative Care for Women Veterans study that both introduced a care manager for women veterans into the system, but also offered an online CALM. What CALM was the acronym? I can't remember what it stands for, Alison, but
coordinated activities for life and something. That's what I'm forgetting. But it's an evidence-based practice for reducing anxiety.
There you go.
Learning and management, I think it is.
I think so.
Activities for learning and management. Yeah.
There we go. Okay. Thank you. But so the first time I spoke with this care manager who was involved with this, she was saying, you know, I'm having the time of my life doing this. This is the best job I ever had. I really wanted to succeed because CALM is a terrific model. So this is month one. She's walked into this. She's incredibly highly motivated to do this. She really believes in the intervention she's delivering. It's super positive. So that was great. But learning is hard, right? So challenges come up. So by month 3, she was talking about, you know, I'm certainly getting much smoother at CALM. Proximity, sitting close together is an issue for some veterans. You don't usually just pull up a chair close to someone you don't know. So that's part of why I spend a little less time doing the computer part. Maybe I'm partly adapting without thinking about it. So she was in a very small office. There wasn't a good setup for being able to, so this CALM was happening on a computer screen. So she needed to be sitting next to the veteran, or at least in a way that they could both see it. But particularly working with women veterans with trauma, she didn't always feel that they were comfortable sitting that closely to her, and she didn't want to make them uncomfortable. So that became a real barrier in terms of how she felt about doing online CALM for a period of time. So she talked about, yeah, I'm pulling back on this. And I wanted to pull this out because A, it's such a great example of how a barrier can impact behavior, but also, you know, she's starting to talk about, I was doing less time on online CALM. So that was a really important thing for us to be aware of so that we could be thinking about how to better support her in her environment. And then by month 11, you know, so this is now 8 months after the month 3 reflection, but she's talking about, I have a lot more confidence. When somebody is, I don't know about this program, I can speak a lot more confidently and say, you know, just hang in there a little bit. We're getting to the good stuff, adding in my own pieces, not just sitting down at a monitor together, going through this stuff. So by month 11, she's really assimilated this. She feels confident about it. She feels confident encouraging veterans to stick with it because she's seen good results. And she's talking about she's adding in her own pieces as well. So you get a lot out of that. You can see she's got a lot more self-efficacy for the delivery. And you can also see she's telling you, I'm adding in my own pieces, which would be, of course, a great cue to probe for more info. So what kind of stuff are you adding in? So you can have a better understanding of what this is looking like in normative practice for her. So this can be just an example of how getting these repeated data with folks in a really in-depth way can provide this beautiful information about what their learning curve looks like, what their relationship with this intervention looks like. And that, of course, is going to have utility if you're thinking about spreading, because other people are likely to have similar experiences.
Can I just make a quick comment there, Erin?
Please do.
Which is just that this is the kind of information that I think we miss when we only do interviews. This is what gets more ethnographic from my perspective, which is that, you know, this person who you're doing the reflections with is on the ground, and it's sort of like she is the eyes on the ground person, and is kind of like the observer in a sense, and, you know, the one experiencing this firsthand, and then sharing that with you because you can't be there to see it. And I just have appreciated the reflection so much because there's more of this type of micro information. So it's not so micro that you're seeing and hearing like what's happening on a daily basis, but it is more micro than, you know, asking like at mid-implementation, what types of You know, in what ways have you changed such and such intervention or something like that? Like, you're going to miss more of those. I think you're going to miss a lot of those details of, you know, how she's feeling about doing the intervention and what she's doing. And so I just feel like it really enhances the picture that we get from interviews, and we don't, you know, typically do interviews that frequently. So it really is kind of filling in, which is always what we wanted it to do. But this is such a good example of in action how I think that works in the reflections, is that you're really getting more of the micro notations. And I know for this person and many others, they were like, oh, I'm definitely going to have to tell Erin about this during reflections. So they're actually like, when you get used to it, you're actually like holding on to information that you know you're going to want to get into the reflections. And I do that too, because I know there's going to be this opportunity for documentation via Erin. So I hang on to things and say, that's got to be part of what I talk with her about next week or something like that. So it kind of enhances that attentiveness too, which I think is really a great feature of it. So I just wanted to share that.
No, I think that's great. And I have so many thoughts about what you just said, because it just kind of getting meta again a little bit and thinking about when are these useful. Now, if you're doing a study where you're implementing something in 100 sites, do you want that level of granular data? Heck no, because nobody's going to ever analyze it. It's a waste of everybody's time. You're going to stress everybody out, make everybody miserable for no reason. But if you're talking about, okay, we are doing something new, we're maybe doing it in a limited number of sites, whatever that number might be for your team, we really want to do some in-depth stuff on the front end. So we have a great understanding. Maybe the first 10 sites, we do these kind of reflections. So we really get a great granular understanding of where the challenges are, how it's going. If there's a learning curve, how do we support that learning curve? We're moving faster. And then we're going to take that data and we're going to inform how we work in phase 2 with the next round of sites or something like that. So just being thoughtful about how do we make sure whether or not these are a good fit for your project, but how do you get the right level of data for the work that you're trying to do? And I do think, I think if you're interviewing somebody after implementation and it's a year later, they're just not going to remember this kind of stuff. So we can't learn from it. So if there's a way to introduce this kind of intermittent, not too heavy, but really thoughtful kind of data collection into what you're doing, it can be very useful. So. Okay. And also it's just incredibly fun and interesting, to be honest, to see how people work with these things over time, because it's amazing. I mean, you see professionals talking about how they do the work they do, and it's just absolutely fascinating. Okay. I'll talk a little bit more. I notice we're getting on towards time and everybody's probably tired of listening to talking, but Zoom fatigue is real. But I want to talk about a couple more things, and then we're going to get to the part where we all just sit and talk about things. So I just want to show this. This is an example of timeline mapping that was taken from a poster that Julian Brunner led that was at DNI last year, and he has a paper he's working on now, fleshing this out in more detail. But this is one of the ways that we have integrated reflections data with some more quantitative data. So you'll see the green line there is mapping uptake of the CV toolkit template in clinical settings in a particular site. And we developed one of these site profiles for 5 different sites. And this is just one example. But what we were able to do in the reflections data was to go through and look at, okay, kind of what were the key contextual factors that were happening in this site that were unique and really stood out? What are the implementation strategies and when were those coming online in terms of how this was happening? And then what were the adaptations that were made to the CV toolkit template in this site? So we were able to look at those specifically. The reflections allowed us both to identify all of those different things and to situate them in time for each site, so that we were able to really look at how was all this playing out. I will say it gets much more interesting when you start comparing across sites and seeing sort of what was shared and what was unique and what did the curve look like and what was the relationship between activities and the curve of uptake and whatnot. But this is really just kind of a starter for something we're working on and really trying to think about novel ways to integrate these data. And we are learning a lot. So stay tuned. I think Julian's going to do some really lovely things with that over time. And another example, I don't want to beat people to death, but you can just think about different ways you can integrate reflections with other kinds of data. So on the DPP study that Tanaz Moin was the PI for, we were able to pull data from multiple places. Again, so we had data on clinical outcomes. So for example, if you were comparing the online version of DPP versus the in-person version of DPP, the story you got out of the clinical outcomes was really that there was greatest weight loss and greatest engagement in ongoing activities associated with the online DPP option. So just in terms of clinical options, that was clearly the option that had the best clinical outcomes for the women veterans involved. If you look at the reflections data, one of the things we saw was that adaptations occurred much more frequently in the in-person groups. So the in-person groups were maybe easier to tailor to local needs or individual needs. So that was a piece of the story. But then in the interviews, we also saw that women veterans talked a lot about having the option to select an in-person versus online modality that worked best for them. So this was really a case where we learned something unique from each of these data sources, and we were able to pull these together to say, in terms of planning for SCRED, well, we know that clinical outcomes are going to be most effective for the online DPP version, but we also know that that's probably not going to work for all women. So we need to have some options available. And this is probably the most useful way to make these options available and adapt to places where the women may have specific needs. So being able to pull together those different kinds of data allowed us to tell a much richer, more full story about who and when and what kind of intervention was going to be best for the people involved, or at least to have these kind of options. I just wanted to include this because I thought this was a really nice paper that came out recently that offered a checklist of mixed methods in health services management research. And they talk about kind of a checklist for what sorts of things you should include in your manuscripts. I think most of the people on this training are probably really good at this, but I always love checklists because they remind me of how to do the work the right way. So this was a great example of that. And then I loved this paper. This came out frequently. I'm only going to talk for about 1 more minute. I love this paper. This is getting really explicitly at this question of when you're gathering regular implementation data in these kind of check-ins with people, does that change implementation? And they asked that question of a bunch of people involved in regular phone check-ins, like the reflections. I don't think they were specifically reflections, but that kind of thing. And some people said, yeah, it changed things. And some people said, no, it didn't change things. But this is such a lovely paper in terms of really thinking about how does this kind of attunement to the process change the way we go about the implementation work? And do we either need to be mindful of how to minimize any impact, or just to be mindful of how to appreciate that impact and work with it in a thoughtful way? So there's lots to be said about that, but everyone interested in this at all should read this paper because it's lovely. And then I had promised, this is one of the ways we're tackling right now for the project where I mentioned that they specifically want feedback on what's going well and what's not. So in my ethnographic training, I was really trained to keep your data separate from your interpretation. So you want to be thoughtful about what is in the data, what is distilled from the data, and then where are you taking that next step in terms of interpretation. Very similar to what we do when we're talking about, memoing or whatnot. So we, in building out this kind of sample matrix for this process eval piece of what we're doing, we are doing kind of a rapid qualitative analysis, structured summary templates that we pull into a matrix, looking at some of these key factors in terms of what are folks working on, what are the contextual factors they're running into, what are the adaptations that are happening. And we're doing all that on the left side of the matrix. But then on the right side of the matrix, we're saying, okay, we're stepping back and saying, okay, what are we seeing in terms of what's really working well right now? And to some extent within each reflection, but also looking across all of the reflections, because we're getting a lot of this data coming in from multiple people. But also being able to say, based on what we're seeing right now, here's some areas where we need to pay more attention as a team because this isn't working as well. And we're working on this as a way of trying to embrace that tension of what's working, what's not working, and how do we use the reflections as a productive way of supporting the team effectively, but also really maintaining that psychological safety. So that is a tension we are currently embracing in real time. So I would love to hear from folks if they have found really healthy, helpful ways to do that as well. Kind of getting to take homes, as I've said, analysis can be approached in a variety of ways. It can be done during implementation or post-implementation as part of formative or process evaluation. The data really are compatible with an array of frameworks and taxonomies. I have not said this before. I do not think they are ideal for constructs requiring a high degree of specification. So for example, if we're talking about coding implementation strategies, I think they work well for that. If then I was going to take that list of implementation strategies and do something like Proctor's 7 domains of specifying those implementation strategies, at that point, I suspect I would have to go back and do some additional checking with the team about how those implementation strategies were handled. I do not think that kind of precision data is necessarily going to be involved, necessarily going to be contained in these reflections, unless you have built them to be very precise around that. So I would be thought there may be places where you're going to find out something happened, but you're not necessarily going to get all of the information you need about that. You may get a signal there that it happened and then have to go do some additional checking to find out more about the precision there. So that's something to be mindful of. And then getting to the point around unintended consequences, because reflections are inherently reflective, they may have some consequences for how implementation is conducted. And it's important to have some attention to and some dialogue with the team around what are the needs and goals for this particular project for reflections and how to tailor them to best fit those needs. I'll take a moment to just comment on limitations once more. Of course, reflections require time and commitment and buy-in from the participants involved. They absolutely require trust. They require psychological safety. It has to be okay to screw up because we all do. And we need to know how we do it so we can learn from it. It's important. They're not perfect for capturing precise dates or specification. So if you really need that precision about a specific day that something happened or all of the different pieces of something, this probably isn't the method that you need for that. They also require some upfront team discussion and agreement about how information is going to be used. So that's important. And I wouldn't say that they replace direct observation at all, but they can be a really useful lens onto what's happening. And then just getting back to this piece about ethnographic approaches can be really valuable, particularly with relation to context and change over time. We need these kind of pragmatic strategies. So if you are doing other things like this that you think have value and are useful for the toolkit that we all need, please share them and teach us about them because they're really important. In the meantime, I think reflections are one way of doing this that we've found to be super helpful. So that's all.
Thank you so much, Erin. I don't have pending questions in the chat. But something that I was just thinking about, and I know we only have a couple minutes left, but I don't even know if you and I have talked about this, but I'm thinking, if you set up the expectation that the reflections data is going to be used formatively, that you would potentially shift gears either in minor or major ways because of what you're learning in reflections. Would you, from a little bit more of a logistical standpoint, but I think there's something conceptual in it too, but how and where would you document that shift happened and that shift might have happened because of what was learned from the reflections? Like, would you add that? Like, would you have a memo about the reflections that would document that? Or like, what are your thoughts on what we would do in a situation like that?
It's such an interesting question. And we haven't really used them in that way. I know there are other teams using that, so I wanted to make sure and bring that out, but wouldn't say I'm the most experienced at it. I will say in terms of the work that Julian and I are doing with the timeline mapping, there's a lot in the reflections about yeah, we're trying to do this and this isn't working, and we're going to try this and da, da, da. And you really do get a sense of kind of when decisions were made and when things shifted, because you're, particularly if you're good about, keeping them recurrent. So you can say, okay, this was, April 2019, we were looking at this, and this is when this shifted, and we did this. And then by June, we had it in place, and you can really do that. I do think though, so I was thinking about this in relationship to stages for implementation completion. So the SIC, which we're using in Empower 2.0, but didn't use in Empower 1.0. I think there are going to be a lot of, there's going to be a lot of places where we can say for this site, oh yeah, we hit this milestone, and we're going to know that from the reflections data. But if we want to be able to track each site's progression across the milestones that they need to achieve in order to achieve implementation, and the dates on which that occurred, we've got to track in the SIC, because that's a much more precise level of detail. Yeah. So I think if you know exactly what you need to know to measure your progress, you're better off with something like the SIC or a log that's structured in that way. If you want to build in flexibility for all the things you don't know yet are going to happen, then reflections are really good for that. And I think that's kind of what I was trying to get out in the design section. It's really about building out your evaluation plan in a way that's going to capture both the structure and the flexibility you need in a way that's not going to drive your team crazy, because that's not nice. So.
Oh, you're getting thank yous in the chat. And Kim, I see your question, and I'll get back to you just because I'm not sure we can do justice to that in our 2 minutes remaining. The recording will be made available on our YouTube channel, and Elena is going to put a link to an extremely brief survey evaluation to get your feedback on today's session. If you could take truly a moment and give us your feedback and comments, we would absolutely greatly appreciate it. I promise it's not long, and we really, really need it. So please complete it. If everyone could just join me in thanking Erin so much for leading us in this session today, and sharing all of her wisdom and expertise with us. You'll see in the chat, Erin, that people are extremely appreciative of all that you shared. So thank you so much. Stay tuned for other workshops and such through the UCLA 3R Hub. We're happy to continue on for another year. So we'll be doing beachside chats and workshops and all kinds of things coming up in the next coming year. So thank you again, Erin. This was wonderful, and really, really appreciate your time and expertise. Thank you.
And thank you everybody for hanging in there. 2 hours is a long time. So you guys did great. Thank you.
Thank you. Bye, everyone.
Bye.